clients that come in that have the same patterns of discomfort or joint pain or muscle pain in their bodies. Hi everybody, and welcome to Your Second 50, where I explore topics intended to optimize every body 50, 60, 70, and above. Hi everybody, and welcome to the Judy Terrell Show. So if you're joining me right now, then you are on episode number 3 of my 6-part series where I am showing you exercises that when you are over 60 and actually over 50, but 60, 70, and 80s, that can reverse the imbalances that occur from living our everyday lives. It is my experience as a 60-year-old woman myself who's been in a practice for 42 years and who has specialized in the over 50 population for the last decade that I see over and over again clients that come in that have the same patterns of discomfort or joint pain or muscle pain in their bodies, and go to a variety of clinicians and medical practitioners to figure out what's wrong. And they'll find maybe a shoulder impingement or some tendonitis in the elbows or lower back, some arthritis, but nothing that is really operable and that they can surgically repair. So then they are given a variety of pain management techniques and medicines. And so I'm doing this series so that, I can address from what I call behavioral medicine. And what I mean by behavioral medicine in the instance of this series is what are exercises that I can teach and that I do teach to my clients that are reversing the imbalances that happen from living our everyday lives and being decades on the planet, such that they actually eliminate, or in some cases, or significantly reduce discomfort and pain that we're feeling. So this is episode number 3. And what I'm going to address in this episode, and this is becoming more and more prevalent, and I think it has to do with the fact that we are on devices, and that, our computers and our cell phones and a variety of other things where we are doing a lot of work with our digits here. And we're in positions like, if you look at this from the side, you'll see where we are in a flexed wrist position. And if you add to our everyday life where we're doing things like this, the fact that many of us sleep in different positions where our hands are like this as well, we get the forearm muscles get shortened, but they're also weak. So they're weak and they are tight. And then we'll go out and do things that involve gripping, and a variety of other everyday things that then will end up being pain in the elbow, either the inside or the outside. It'll get diagnosed as either golfer's or tennis elbow, and you may actually be a golfer or tennis or pickleball player. But that where you're gripping a racket or a pole, the golf club, and then you've got the force of hitting the ball. So you're gripping, and then these forearm muscles take the brunt of that impact, and it develops into a tendonitis either on the inside or the outside of the elbow. All right. Or you're not a tennis or a golf player, but you get diagnosed with tennis or golf elbow because of what I was just talking about. We're doing all everyday things and we're in this position a lot. And that leads to weak and tight forearm muscles that attach in a variety of points around your elbow joint into the bones of your upper arm. And then they get inflamed and then you have pain. So I have found that if I can teach a forearm extension, that helps to take away the pain in the elbow because it stretches as well as strengthens the muscles that are shortened and tighter in the forearms. And I have had a lot of success with my clients when I teach this exercise. I'm going to teach you in just in a moment. It has to be done consistently. I'm going to tell you that right out the gate. You can't do it once or twice and be like, I didn't feel a difference, so I'm not going to do it. you got to give yourself a good 2 weeks of doing this on a consistent basis. And then when the pain's gone, you want to also keep doing this exercise. This whole series, I'm teaching exercises that when the series is done, you have 6 exercises that you should be doing on a daily basis or every other day ongoingly, so that when you get out of the pain syndromes that I'm teaching you to help to get out of, you don't have them just come back, okay? So what can you do to strengthen these forearm muscles? And I have just the thing, and I'm taking my little props right here because everybody has the piece of exercise equipment that I'm going to demonstrate this with, and it is a rubber band. Okay, so you take a rubber band and you wrap it around your fingers and your thumb. Okay, just like that. Then you straighten your elbow, and you can use your hand or you can put your arm over a table. And then what you're going to do is you're going to extend out, extend out, extend out. And that's your repetitions. 1, 2. Now you don't want to do this with a bent elbow. You want to keep the elbow out straight. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. I usually tell people to do 15 and 20, and to do, even if you only have pain on one side, I would do the other side as well. 1, 2, 3, 4, 5, 6, and I'm doing this 7, 8, because you can actually see 9, these forearm muscles, 10, 11, 12, 13, 14, and 15 working. Now, I recommend that you do this exercise. You can do this one daily, but every other day is also good. You want to do 15 reps per set, and you want to do somewhere 3 to 4 sets per day. All right. Now, what will happen, this is one rubber band. And just like with a weight, you're going to get to the point where this is not enough. Or you may start out, and this is really not that challenging to me, just one rubber band. So the way you advance this, and if one is not enough right from the get-go, you're going to take 2 of them and do the same exercise. Now, you can see more prominently these muscles, right? Because this is much more resistance. Now, if I was going to do this, 2 of these rubber bands seems to be a good resistance for me because I can feel this. But, the sky's the limit here. If 2 is not enough, then take 3. And that is much more of a strain. And I'm really not getting the full range. So this is actually 3 is too much for me. And you want to keep that elbow straight. So what you do is, like I said, do this either daily, 15 reps, 15 to 20, 3 to 4 sets, 1, 2, 3, or however many rubber bands it takes for you to get the resistance that you can feel the work as you're doing it, but you can also still extend the fingers all the way. You don't want to do it where you can only get in this range, right? You want to get a full range. And like I said, when you execute this, you want to keep your elbows straight, because if you're bending it, you're kind of taking some of the stretch phase out, and you want to have this fully extended so that you are strengthened in the fully extended position, because that's what's going to get the tendinitis to calm down. All right, so this is exercise number 3. In the first 2 that I did in the series, I was doing some corrective exercises for shoulder joint issues. People get impingements and pain syndromes because we are at our devices and sitting, and we're forward rounded like this, just being alive on the planet, gravity pushing down for decades. So I did 2 exercises that will help to pull the shoulders back. So now any issues that you might have with a misalignment of the bones that make up your shoulder, I gave you 2 exercises to correct for that. The one I just executed and showed you, this is one to correct if you're having some joint pain in your elbows. And we got the shoulders and the elbows covered. All right, this is episode number 3. You have 3 exercises that we're now starting to get into a routine. We have 3 more to go in this series. I'm going to teach you 3 more. One of them is going to address the hip and lower back area, and that will be the next one. So stay tuned. I'm doing this series, and I do all my series that I've put together so far, because as a 60-year-old female, I want my second 50 years on the planet to be even better than my first 50. And I'm sure that you feel the same way. And so I'm putting out this information so we can all be in the same, mindset of working on that second 50 to be the best. And if you're finding that you're getting some good results from the series, then please go to my website, judyterrell.com, where you'll find even, all my series are listed there, as well as some other digital products that you can buy to add to your arsenal for making that second 50 even better than the first. All right, stay tuned for episode number 4. And as always, be well. Celebrate life. Enjoy. Thanks for listening, everybody. And if you'd like to have access to some of my additional resources, I can be found at Facebook, Instagram, YouTube, and on my website, www.judyterrell.com.